Welcome to all my dears. Today we are going to discuss about a new subject or new topic, that is pre-diabetes. What is pre-diabetes? Before that, let us see what actually the mechanism behind diabetes itself. As you know, the condition of diabetes may be because of complete absence of insulin or relative absence of insulin, or even though there may be insulin is sufficient insulin, but the insulin is not act properly, or the insulin is getting resisted, or insulin antagonism. Near about 85% of diabetic patients belong to the insulin resistance category, that is type 2 categories. Near about 5 to 10% of the diabetics belongs to type 1 diabetes or insulin dependent diabetes. The word insulin dependent means the patient can withstand only if we artificially induce insulin to our patient. Here the insulin is acting as a key to open the cell membrane to get entry the glucose molecule. That means if there is no sufficient or efficient insulin in our blood, even though we had the energy in the form of glucose, we cannot use the same. So anything which affects the quantity or quality of insulin, that will leads to persistent elevation of blood glucose in our blood. That is what we call the hyperglycemia. In our clinical practice, whenever we came to diagnose a patient with diabetes, it means that our patient is already having diabetes since 10 or 20 years back. It means that even in our patient with the diabetes, most of our patient may not have the symptoms as we expect in a patient with diabetes, like polyuria, polyphagia or polydipsia. At the time of diabetes, unfortunately, the same may affect our multi-level systems. In that condition, unfortunately, the diabetes may affect the renal system, or our vision, or as diabetes retinopathy, or it may affect our heart as diabetic cardiopathy or neuropathy or encephalopathy or arthropathy, something like that. That means as the disease continues to progress, it is not necessary to give the specific symptoms as we expect. That is why the diabetes is considered as a silent killer. In such condition, what can we do? You know that prevention is better than a cure. In other way, we can say that the early detection, real-time diagnosis plays great important role, especially such a lifestyle silent killer diseases. Let us see the mechanism of blood glucose level balanced by our body. Depending on the bodily demand, our stored glycogen will converted into glucose from our liver, and the same may be released into the bloodstream. At the same time, via beta cells, insulin is released and the blood glucose is get entry into the cell and do the needable metabolic activities. As we mentioned earlier, most of our diabetic patients are insulin resistant, or the patient may be with a type 2 diabetes. Like that, most of the pre-diabetic patients are also comes under the group of type 2. That means there may be sufficient insulin, but the insulin is not efficient. In such condition, as an adaptive mechanism, there may be increased insulin synthesis by our pancreas that leads to a condition known as hyperinsulinemia. In such condition, the patient may suddenly become hypoglycemia, especially after food. So, in pre-diabetic one, on examination, the blood glucose level may not be high, but it will not touch us the normal, or it may be even subnormal. Let us see how can we diagnose a case of suspected pre-diabetic one. Either our patient may be a obese personality, or our patient may be with a family history of diabetes. Even in absence of such a evaluation histories, on examination, if the FBS ranging from 100 to 125 milligram percentage and ppbs with a 140 milligram percentage, our patient can be considered as a pre-diabetic one. With a FBS 100 to 125, the ppbs can also be ranging from 140 to 199 milligram percentage also. Even though we cannot much more rely over the values of FBS, ppbs or RBS. As you know that these values may fluctuate with various factors. So that nowadays it is replaced by evaluating the value with a glycosylated hemoglobin. That means evaluation of HbA1c plays great important role in diagnosing the pre-diabetic status, because it is more and more sensitive and specific than that of the values of FBS or ppbs. On examination, if the HbA1c value is 5.7 to 6.4, our patient will be usually with a condition of pre-diabetic one. At the same time, keep in mind, in patients with various types of anemia, or in patient already with some renal disorders, or in patient with chronic hepatitis, in such condition, we cannot only consider, or we cannot only pinpoint the diagnosis of pre-diabetes only with the glycated hemoglobin, because the same may also seems to be fluctuate with the above mentioned conditions. Next, about the preventive aspect of patient with a pre-diabetic not to get a frank diabetic one. Number one is lifestyle modification. Number two, exercise. Number three, regular food habits, regular bowel habits, regular sleep habits, and keeping normal BMI. By screening and diagnosing patients with possibilities of pre-diabetic, we can save the patient not to get a very frank diabetes or uncontrolled diabetes and its complications. Because nowadays diabetes is considered as a mother of all disease. As you know, the possible long-term complication of diabetes as either as cardiac arrest or as stroke or renal failure or neurological or psychological deficits or involvement of multi-organ failure may be the long-term complications. That is why it is very essential to either to prevent or to detect the possibilities of diabetes. Thank you.